Bismillah ar-Rahman ar-Rahim. Assalamu alaikum. I am Professor Adam Ahmad Adam. You are welcome to this bacteriology lecture. It is about Bacillus anthracis. It causes the zoonotic disease Anthrax. Zoonotic disease is a disease transmitted between humans and animals. The bacterium is gram-positive bacillus, as you see in the pictures. It is facultative and aerobe, and it is spore forming. It forms spore. You see here the unstained areas in the bacilli are the spores, endospores. The bacterium is used as a biological weapon of mass destruction. Virulence factors: anthrax toxin, which is a polypeptide. It has three components: protective antigen, edema factor, and lethal factor. The toxin disrupts the immune system. It has a capsule. This capsule is a protein of poly-D-glutamic acid. It resists killing by phagocytosis. Anthrax is primarily a disease of herbivores. Herbivores are grass-eating animals that feed on grass. Man is accidentally infected. The infective stages are the spores. Spores are found in the pasture, which is a grazing land. Spores are heat and dryness resistant endospores. They remain alive for a long time, up to 71 years. The reservoirs for the spores are the herbivores and their products: wool, hides, bones, meat, and other products. Routes of infection. The infection takes place in skin, so there will be skin contact, cutaneous type, inhalation of the spores, intestinal by ingestion or swallowing of the spores, and injection in the drug users. The pathogenesis of anthrax: after exposure, the bacteria will germinate from the spores. So the spores are going to germinate into vegetative bacteria, and in the blood, the bacteria cause bacteremia, and they produce the toxin. So bacteremia and toxemia. The protective antigen carries the edema factor and the lethal factor to the inside of the cells. The combination of protective antigen and edema factor is known as edema toxin. This toxin acts on the blood vessels, leading to increased vascular permeability, and there will be reduction in the blood volume and the extravasation of the fluid from the intravascular compartment to the interstitial compartment will lead to edema, pulmonary edema and peripheral edema. The blood volume will be reduced, leading to hypovolemia. The hypovolemia will lead to hypotension. Hypotension may lead to death. The hypovolemia will lead to reduction in the venous return to the heart. And this will lead to reduction in stroke volume and reduction in cardiac output. And this process ends into hypotension. The protective antigen and the lethal factor combination will be lethal toxin. The lethal toxin acts on the heart, leading to low stroke volume, low cardiac output, hypotension. Also, the lethal toxin will act on the macrophages, affecting here the immune system and the macrophages in the lymph nodes, and there will be impaired immunogenic immune response to the stimulation by the bacteria. Pathogenesis: the bacteria cause bacteremia and toxemia. Capsule resists killing by phagocytosis. Protective antigen binds to cell receptors. It carries lethal factor, which is a protease, and edema factor to the cell. The toxins alter cell signaling, interfering with innate immune response in early stages and induce vascular collapse in late stages. There will be lymphadenopathy, edema, necrosis, and exudate containing macrophages and neutrophils. This table summarizes the main points. The type of anthrax, cutaneous, it constitutes about 95% of anthrax cases. The mode of infection is skin contact. The incubation period ranges from 1 day to 7 days, but might go up to 17 days. The mortality rate is about 5%, which is comparatively low. The source of infection: infected animals and their products, wool, hides, bones, and so on. The intestinal type: the mode of infection is by ingestion or swallowing of the spores. The incubation period ranges from 2 to 7 days. The mortality rate is high, about 50%. The source of infection: meat of infected animals. The pulmonary type: the mode of infection is by inhalation of the spores. The incubation period ranges from 1 day to 7 days, but may be up to 60 days. The mortality rate is high, about 50%. Source of infection: infected animals and their products. Injection: this is heroin injection by the drug users. The incubation period ranges from 1 day to 10 days. The mortality rate is about 30%. The source of infection: contaminated heroin. The treatment: to kill the vegetative bacteria by the drugs penicillin, amoxicillin, and ciprofloxacin, and to neutralize the toxin is by anti-protective antigen antibody. Clinical manifestations: skin ulcers, breathlessness, and diarrhea. Here you see the clinical manifestations of the cutaneous anthrax. You see here there are skin ulcers. The center of the ulcer is black and there is edema. Diagnosis: clinical. Then you collect blood, you culture it. So in the blood agar, you see here the Bacillus anthracis growth. Serology: to detect antibodies against capsule. Treatment: as I have said, antibiotics to kill the vegetative bacteria, penicillin, amoxicillin, and ciprofloxacin. To neutralize the toxin is by anti-protective antigen antibody. The prevention animals and humans vaccination, the vaccine is made from protective antigen. To get rid of the dead infected animals is by incineration and burial of these animals. So you set fire on the dead animal and you bury deeply in the ground the ash. I hope that the lecture is understandable and I wish you all the best.